Welcome, everyone. So, in 2023, the U.S. Center for Disease Control and Prevention announced that firearm injury is now the leading cause of death of young people between the ages of 1 and 17. It's why we started Will You Hear Me Now? To give young people a voice on this issue. As you may know, May is also Mental Health Awareness Month. So today we're talking to young people and school students about how gun violence affects their mental health. Moderating today's roundtable is Dr. Anitha Iyer, Director of Behavioral Health Population Management at Mount Sinai Health Partners, and she's Associate Professor of Psychiatry at the Icahn School of Medicine at Mount Sinai. Dr. Iyer is a recognized leader in the innovative delivery of crisis and behavioral health services. Welcome, Anitha.
Thank you so much, Michael. Thank you so much for having me here and giving me this opportunity to speak with our young folks and our future of our country here today. Welcome to our esteemed panelists. I want to just take a moment for each of you to introduce yourselves. So if it's okay, I'll call out your names in the order that you are appearing on my screen. And if you could please briefly just state your name, the grade you are at school, what your age is, and if you're comfortable, what state in the US you are calling in from today. And so let's start with you, Krishi.
Hi, my name is Krishi and I'm 18 years old and I'm a senior in high school right now and I'm from New Jersey.
Thank you. Sarita, how about you next?
Hi, I'm Sarita. I'm 14 years old. I'm a freshman and I'm from New York.
Spencer, we'll go to you next.
Hey, my name is Spencer. I'm 24. I'm a senior in college. I'm from Pennsylvania.
I'm Gavin.
Hi, my name's Gavin. I am 18 years old and I go to school in Pennsylvania.
And Ananya, you can round us out.
Hi, I'm Ananya. I'm a freshman in high school. I'm 14 years old and I live in New York.
Great. Thank you all so much for being here and taking the time to share your insights with us today on this really important topic. Usually in the aftermath of a mass shooting incident, a lot of discussion tends to center around mental health, but sadly, too little of that discussion focuses on the mental health impacts on survivors and people at large, and particularly on young people. So this will be our focus today, and this is where we're really excited to get to hear from each of you, as I said earlier, the future of our country. So with that said, let's turn to the first question. So with the first question, let's start with you, Krishi. Could you tell us a little bit about the main stressors that you face today?
I mean, personally, as I've just finished applying for colleges and everything, there's some factors that I've been looking into. And a few of them would be the academics and of course the safety of each campus and how I feel entering the school and living there for the next 4 years. And I feel like I've visited a few campuses myself and one or two of them I felt weren't in safe areas and I found out shootings happen there quite often. And I found one campus happened practically every month. And I feel especially people with my grade when they're looking into colleges or basically where they want to go next, whether that be in jobs or anything, they want to find the security they're looking for. And I feel that stresses out people, especially seniors in high school too.
Yeah, so it sounds like safety is really top of mind for you, even as you're applying for college. I'm curious, for the rest of the panel, based on what Krishi said or otherwise, are there other specific factors that causes stress to folks your age? For example, social media is one we hear a lot about. And anyone, yeah, Gavin, go for it.
I actually think social media can definitely increase stress. People will sometimes compare themselves and their situations to other people in a bad way that can lead to self-hatred, body dysmorphia, or maybe disdain for a particular person or community.
All great points. Yeah, and there's a good amount of literature on that now, so appreciate you raising that. And Gavin, actually, maybe we can stay with you for the next question. From your perspective, what do you think is the association, if any, of gun violence in our schools and communities and the mental health crisis that we're experiencing as a nation?
It's clear that there definitely is a connection between the rising mental health crisis and gun violence. I think the most prominent thing is suicide rates among teenagers have risen significantly in the last 10 years, and it's not a coincidence that school shootings have also risen. People have realized that, like, students are saying it in my school, but they don't have a platform, unfortunately, to speak on, which is why I think it's important to give them a voice for lawmakers to hear.
That's great. So you're saying there's a direct and clear connection. I'm curious, for the rest of our panel, how do you see society responding to this, if at all? Sarita, go for it.
So I feel like society kind of still seems to like gloss over the importance of it because many issues still go unaddressed within like this conversation of mental health. And I feel like there hasn't been a lot of effort put into actually addressing this, which is why we see so many of the problems and issues that we see today. So like we need to see more effort put into actually addressing this situation and providing platforms for people who are struggling with mental health and for people who are knowledgeable on self-care, how they would promote it.
That's great. Thank you, Sarita, and certainly appreciate all of you taking on this platform today and sharing your thoughts. I think that's an important first step. Ananya, I see you have your hand up. You wanted to add something?
Yeah, I was just gonna say, like, kind of just responding to what we talked about before about like social media and younger people. I think that you see younger people in particular responding to it, especially on social media. And I think that might be one of the positive benefits of it because you see a lot of gun violence movements, a lot of mental health movements lately, and a lot of it is being pushed by Gen Z in particular.
It's really great, right, that to hear all of you sort of noting that young people really have the potential to shape the conversation, including through social media. So actually, it's really intriguing, you know, what you all are saying, right? This connection between your sense of mental well-being and the social environment and the school environment. I'm wondering if we can go a little bit deeper into that. And Ananya, you were just talking, so I wonder if we can stay with you, if you'd like to share your insights a little bit on the school as a learning environment, particularly from a mental health and safety standpoint.
Right. I mean, I think like speaking from my own personal experience, I think that like going to school, there's you kind of start to associate school with gun violence in particular, especially after, I mean, I've grown up seeing it on the news all the time and seeing school shootings happening in the country. So I think that my perception of school has been tarnished a little bit because of that. And I think that that's really unfortunate because I feel like for all young people, we should be associating school with learning and school as a learning environment. And I think that just thinking about, I mean, I live in New York, as I said, just thinking about somebody who might live in Texas where gun laws are even more like loosened and it's more free around all of that. I think that that can be even more terrifying. And I think that having to go to a place every single day and being terrified that you're going to lose your life for trying to seek out an education, I think that that has a really big impact on what we as a generation are capable of, especially when you look at higher education.
Well, that's really powerful to hear. You talking about your sense of school being tarnished. You know, those words are really resonating. I'm curious, kind of from the rest of the panel, you know, if you'd want to add to what Ananya said, and in particular, I'm curious about, you know, what you all need for schools to be in order for them to be that optimal learning environment. Krishi, go for it.
So I think like it's important to have like the safe environment where like children want to learn and they should be able to like correlate these safe environments compared to like having trauma with them or like forever like blurring the line between education and gun violence, which could result if there are like mass shootings like so often, which could just become like the societal norm, which you don't want to see in the future.
Yeah. So protecting the school environment as a sacred space, essentially, is kind of what I'm hearing you say. Does anybody want to add anything to that in terms of sort of what do you need to see in order for school to be this optimal learning environment? Gavin, go for it.
Thankfully, my school, I think, does a good job on that aspect. We have multiple clubs that are involved with promoting mental health awareness. It's something that all the teachers are really positive about. We have interactive counselors, and I think our school is one of the more fortunate ones in the area, and I just hope that it's something that other schools will be able to have as well.
Right. So I note what you said about counselors in the school environment. I want to come back to that because that's a really important point. Just to keep us moving, this conversation about gun violence in schools is sort of somewhat unique to the United States. I noted sort of, Ananya, you said something about Texas, and, there are different laws at play which make the school environment perhaps even more nerve-wracking for students. And certainly our country has struggled in its efforts to make schools safer, right? So, Sarita, I'm curious if I could turn to you for the next question, in terms of what would make schools safer, and in particular, because there has been this conversation nationally about arming teachers as a way to increase school safety. I'm curious if you'd be able to share some insights on that.
Well, I think we've already established a connection between mental health and gun violence, and there seems to be like a sort of pipeline between unaddressed mental health issues and gun violence. So, one of the first things that we should do is implement um, more clubs and like more clubs that promote mental health, because as I've said, it's what fuels people into this like gun violence cycle, and it's a very violent cycle. And also on what you said, there's also like a lot of people arming teachers. Like there's been some calls for giving guns to teachers, which I don't think is the best solution to the problem, especially because it's like school is already seen as a stressor because of gun violence, and we shouldn't be addressing this issue with more guns, especially because this can make school a much more intimidating place. Especially from a student standpoint, it's probably very intimidating to see their teachers with a firearm, especially knowing that these aren't people that are fully equipped to handle situations where firearms are involved. So I don't see how that is a viable solution to the situation. And I think what we need is more mental health platforms and like removing the stigma from mental health in the first place.
So it's powerful to hear you talking about how it makes the environment even more intimidating. And it doesn't necessarily solve the problem. You want to see is more supports around mental health in the school environment instead. And so just staying with that piece about sort of different legislation and different laws in different states, I'm curious sort of if someone else on the panel wants to chime in on open carry or teacher carry policies, and how that might affect your sense of future choices about school or work environments. Spencer, why don't you take the floor?
Yeah, I really don't believe that allowing teachers to carry guns in schools would make the place more safe. I think that they're supposed to be places of learning, places of education, and not war zones. And if you're always in the back of your mind thinking of what could happen if this were to be the case, and it's frightening, really.
Great, yeah. Ananya, I see you have your hand up as well.
I wanted to kind of expand on what Sarita said a little bit about like it not being a viable solution. Because I think that like when you're putting kids today in an environment where their teachers are actively carrying guns, I think that translates into a different sort of message to them in the long run. Thinking that carrying guns is okay. And I think that that's such a big part of this whole debate around guns, especially like in the Constitution and everything. I also think that like it's important in terms of solutions to look at what's been done in the past in terms of school shootings and look at like the perpetrators of those sorts of crimes. And I think that definitely like you can see that they might come from a long history of abuse or they might have other things that influence them to commit the crime that they did. And I think that it's important for us as a society to not be taking steps that might risk other sorts of this kind of abuse. And I think that's where this law is so harmful.
Mm. So you're talking about sort of many more factors that then need to be considered when you have more weapons in the mix, which aren't clearly thought through. Thank you. Sarita, go for it.
So I just like what Ananya just said like really resonated with me, and I just really wanted to like add on to that because she talked about sending like the message that this would send towards kids, and it I just like to say that like it sends this message that in order to stop violence or in order to find a proper solution, you need to add more violence. So it teaches students to fight violence with violence, which I think is a very dangerous message to send out, especially because it creates a more chaotic environment, and students and kids like they're the youth, and this is what they're learning, and they're learning from their teachers. They should not be learning from the teachers that the only solution to a problem is violence, or the only solution to a problem is weapons, because it is a very dangerous message. It's a very violent message, and it should not be sent out.
Thank you. I appreciate you saying that, and I'm connecting that to what you said earlier about, when we're talking about the weapons and that being the solution, we're not talking about resources for mental health and supports and preventive care, which you had noted earlier. Gavin, you have a follow-up thought?
Yeah, I wanted to note that I think that this problem is something that resonates with me, the legislation for open carry policy, because I live in an area that's politically mixed. And I think adding, just easier access to firearms would just add flames to an already kind of hot political fire that's going on in the area.
Yeah, I appreciate you saying that. It echoes the sort of sense of chaos, I think, that Sarita and Ananya were both noting. So I can see you're all sort of coalescing around this sense of more guns doesn't necessarily make you feel safe. Shifting gears a little bit, I mentioned earlier that this is somewhat of a unique conversation when it comes to the global context. It's not a conversation that necessarily happens in other parts of the world where gun laws are different. And unlike other advanced countries, gun culture is quite enshrined in our Constitution. I think, Ananya, you made reference to the Constitution earlier. Spencer, I'm wondering if we can come to you and round out our panel with the next question. I'm curious how often you, your friends, your family talk about gun violence in America. How much of a part of your day-to-day discussions or family and social discussions is gun violence and gun culture?
Yeah, it's quite often. I don't want to say constant, but it's frequent whenever there's something in the news or something locally that happens. It's this kind of reoccurring conversation that keeps coming up, and it always feels like the same points are being hit, but no action is ever taken after the fact, and it feels like hopeless or helpless that we keep hearing the same events occurring, and then the same solutions are put forward, but nothing is really ever taken into account. So this general sense of like hopelessness is kind of what shrouds it all, and it's upsetting, and frankly, yeah.
It's hard to hear, right? A young person talking about a sense of hopelessness around our social fabric related to a topic that sort of seems to be ever present. I'm wondering if we can kind of shift a little bit in our direction with this last question. And, I really just want to open it up to any of you to jump in as you have been to respond to this, because perhaps the most important part of a conversation about mental health is what one can do to get support when they're feeling down, and certainly when they're in a situation of crisis, including the types of crises you've all been referencing over the course of this conversation. So I'd love to hear from this panel what advice you'd offer your peers who may be experiencing personal struggles, including around their mental health. Gavin.
I found a really simple but effective solution is just talking to another human being. I think, well, we are social creatures, so just communicating with somebody, I think, can really bring up your mood, even if it's Not necessarily that they don't need to be professional. It doesn't need to be therapy. It could just be a friend, family member, counselor, teacher, anybody, just someone to talk to get your ideas off your chest.
Great, thank you. Sarita.
Just to like piggyback what he said. A lot of like kids, I feel, aren't very like enthusiastic about having more like deep conversations with their parents. So I'll acknowledge that and just go ahead and say that friends or like close friends are probably the best way to get back into a better mental state, especially because it's less awkward between you two. It's a more easygoing, informal conversation where you could just, it's a very open conversation where you could just talk one on one with a friend who you're close to, and it's less awkward. And I think that it's the best way to address your mental health issues.
Great, thank you, Sarita. Ananya.
I just want to say, like, I completely agree with what Gavin and Sarita said. Like, I 100% think that talking to another human is absolutely really helpful when you have feelings that you need to get off your chest, especially someone close in age to you. But I just want to sort of acknowledge the people who might feel like they can't trust anyone on that sort of level, and they can't really see themselves confiding in anybody. I think that then you kind of have to look to yourself to be able to get your feelings out. And I think that there's a lot of ways that people could do that if they're not comfortable speaking out about what they might be going through. I think definitely like it's just like really small, simple things, but like journaling out what you might think, listening to music that might help bring up your mood. I think those are all sorts of things that can influence your mental health in positive ways. But I also just think that like a lot of times people tend to forget that like what they're feeling is valid and they invalidate what they are feeling. And I think that it's important to remind, especially young people, just remind them that like what they're going through is normal, especially for a human being.
Yeah, thank you. Krishi.
Yeah, I agree with what all three of them have said so far too, pretty much. And I guess like a way if people are like not able to talk to anyone or they feel like they can't, could also be through like anonymous helplines, which also like help people like kind of just talk out what they're feeling without being like, I guess like they're not really held to like what other people might think of them or anything like that. And if they are comfortable, they could also probably go through therapy where they can help in like delving into like the core of the problem and like solving like what the actual issue is compared to like the problems that may like branch out from this like mental health problem.
Yeah, great. Thank you. And Spencer.
I mean, well, what they've said is perfect. Utilizing your support network, your friends, your family, people that you trust and care about you, and you can always reach out. It feels sometimes like you're alone and things are hopeless and you can't really move forward, but you can, and it's not always easy. It's a process, but it's something that takes time and work, and with a good support network and with help, you can make it through.
I think that is such a beautiful, positive note to wrap up this roundtable on, this idea that there is hope, that mental health crises are solvable, and there is a solution and there are resources out there. I couldn't have found a better way to wrap this conversation up on an actionable and positive note. So on that, I will turn it over back to you, Michael. Thank you so much for giving me this opportunity to talk with these bright minds today.
So yeah, bright minds they are. And this really is our mission to continue giving a voice to young people and to hear about their concerns about gun violence, school safety. And importantly, this month, we're really looking at what that means as an impact to their mental health and just their general well-being. And so throughout May and the coming months, we will be sharing the recording of today's roundtable on our social media outlets, including Facebook, YouTube, X, and of course our own webpage, willyouhearmenow, which is all one word, .com. A transcript of this discussion is also going to be available on willyouhearmenow.com, along with some more recorded messages from young people. We're always collecting them and adding and refreshing our site with new voices, new young voices. And we're also going to have additional resources and professional advice related to mental health awareness as well. So again, thank you everyone for coming today. Thank you to the Will You Hear Me Now team, and have a great day, everyone. Thank you.
Thank you, everyone.
Thank you.
Thank you.
Have a great day.